I think I'll just go ahead and get started here and just introduce myself. First of all, I'm David Hutton. I'm an associate professor in the department. I've met a lot of you in interviews. Um, I'm the chair of the admissions committee, so very invested in your progress. And just want to start off and thank you for joining us today here. And I wanted to just reiterate our congratulations on getting admitted to our program. Today is an opportunity for us to tell you more about the program to help you as you're making your decision about what you want to do next year. Give you as much information as possible with the University of Michigan so you know what you're getting into if you come here to our program. You've seen some videos about the background of the University of Michigan and health management policy already. I'm not going to, bore you with a lot of those details. But if you want to see those videos, if you missed those at some point, please reach out to myself or Charlita or anyone else on our admissions staff. We're happy to get that information for you. What we're going to do today is give you a little more real-time interactive experience with our students, our alums, and some faculty. So as you can see on your screens here, you should be seeing our agenda for today. We'll have a HMP student panel here, and they'll tell you kind of the nitty-gritty of what it's like being a student in our program. And then we'll have an alumni panel, which will tell you a little bit about kind of our alums and their perspective on the program and what their careers look like after graduation. And then at 6 o'clock, we'll have some time for some breakout rooms where you can get exposed to some faculty. And as faculty, we love to talk, or I love to talk, but I'm going to hold off here, cut myself off, and really give you an opportunity to talk with the students. So I'll pass it over to our student panel, and I think Michelle, Mohit, and we'll get a bunch of them. I'll let them introduce themselves. So welcome and thank you for joining, and congratulations on being admitted to our program.
Thank you so much, Dr. Hutton. Hello, everyone. Thank you guys so much for joining us this evening. I am absolutely excited to get to talk to you guys and get to know a little bit about you guys today. My name is Michelle, and I am a first-year MPH candidate here at the University of Michigan. I'll be the moderator for this evening, and the way we want to organize this is I'll have a couple of our panelists introduce themselves, their names, where they're from, where they did undergrad, and kind of tell us why they chose Michigan. Once they're done with that, I'll ask them a couple other questions, and you guys can go ahead and ask questions in the chat on whatever you guys want to know. We are here to be as honest as possible, as authentic as possible, so don't hold anything back. Ask all the questions you want to know, because we were once in your shoes, and we want to make sure you guys have all the information you need to make the best decision for you guys moving forward. So with that being said, I'm going to go ahead and give it over to Mohit to go ahead and introduce himself.
Hey guys, my name is Mohit Daga. I'm a first-year MHSA student, and I graduated from Kent State University in 2019. If you're not familiar with what Kent State is, don't worry. A lot of people really don't. It's right outside of Cleveland. And I was originally, I come from a biology background, so I came into this program trying to go towards the administration side.
I'll go ahead and pass it over to Robert.
Hi, everybody. Congratulations on getting in. Definitely a really exciting time, and also lots of reasons to be optimistic and hopeful for the fall. So I'm really excited for all of you. So I'm Robert, originally from Michigan, this great state. Went out east to Philly to do college at Penn, where I studied biology and business. After college, I ended up working in consulting for a little bit, and then later in corporate strategy at a consumer goods company, and then came back in 2019 to start my degree here. So I'm currently doing my MPH and then also doing my MBA as well. So I will be doing my third and final year next year. So excited to be here. Looking forward to meeting you all.
Thank you. And I'll go ahead and pass it to Jess.
Hi, everyone. Congratulations on getting admitted to HMP. I remember when I was admitted, I was super excited, and I'm so happy to talk about my HMP experience. So I'm a second year MHSA candidate. I'm originally from Michigan, so Canton, Michigan, which is where I'm currently residing. So like 20 minutes west of Ann Arbor. I went to undergrad at the University of Michigan Dearborn, so it's a sister school close to Detroit. Studied public health and then took a gap year and worked for the American Academy of Pediatrics, specifically around quality improvement, which if you get admitted to this program, you'll take a class on quality improvement with Andy Ryan. And then decided that I wanted to go back to school. And so yeah, here I am. So happy to answer any questions and excited for this panel.
Thank you. And our last panelist, Sienna.
Hi, welcome. So I echo the congratulations of all of my other students. I am originally from Idaho, and then I graduated in 2020 from Eastern Illinois University with a degree in business management and health administration. And I am currently a first year MPH student in the global health track.
Fantastic. Thank you. And a little bit more about me. Like I said earlier, my name is Michelle. I'm a first year MPH student. I also attended the University of Wisconsin-Madison, pursuing a degree in psychology and human development and family studies. And I also obtained 2 certificates in entrepreneurship and global health. And straight from undergrad, I came right to Michigan to pursue my MPH. So yes. Alrighty, so the first question I have for you guys is why Michigan? Like we hear all about Michigan, how great our program is and all these great things, but why did you guys choose Michigan? Like what stood out about our university to you guys? Anybody can answer too.
So I can go first. So yes, I am, a hardcore Michigander, but I would also say that I did look at other schools too. And the reason why I ultimately chose Michigan was after doing some research, whereas I was talking to students and also talking to faculty, I felt that the Michigan faculty and students were the most honest. I did ask really difficult questions when I was interviewing faculty and students, and I honestly felt like they were giving me the most honest answers. And I also think that Michigan, the nice thing about Michigan is that all of our graduate programs are top 10, and you do have the flexibility within your schedule to take classes at Ross, which is a business school. Like I take classes at Ross. I also take classes at the social work school, the public policy school. So you really have that flexibility to one, network with other students in different programs, but also be able to meet faculty there and really get to learn like the interdisciplinary of how public health intersects with that. And I also have to put in a plug because I know you guys will be also having a panel with alumni, is that our alumni network is amazing. When we say that we are the Michigan Mafia, it is true. And so that is ultimately why I chose Michigan.
Amazing.
I guess I can add to that. One of the biggest draws for me to come to Michigan as someone who's very interested in going into like further academia and research in general is that Michigan is the #1 public research institution in the United States. And there are a ton of opportunities for students to get involved and work on teams with faculty to kind of gain some research experience.
Yeah, I think both Jessica and Sienna covered a lot of it. I am originally from Michigan, so I feel like I was always destined to have to come to the University of Michigan, which a lot of my family members have come to. I think what's great about Michigan, as they've mentioned, is there's so many resources across the university because it's so big that you can really craft a journey that you want to embark on. So when I came back here, for example, I was really interested in food policy as well. And we have a great nutritional sciences department here, but there's something called the Sustainable Food Program that I think is based out of maybe a combination of like literature, sciences, and arts and dental school. But anyway, my point here being that anyone can take part in this resource, right? Like it's not limited just to people who are in LSA or Cs. And, there's also even a farm here at the University of Michigan for people who are really interested in, that component of the food world as well too. So I think whatever your interests are, because the university is so big, like you'll find people here at all different schools who can help you on your way.
Yeah, I guess my four classmates have kind of spoken on to most of what I was going to say, but like Robert, I feel like it was my destiny because I'm from Columbus, Ohio. So coming to Michigan was like the natural fit. But for me, coming from a school, a small school like Kent, I really wanted to go to a bigger school.
Mhm.
And you know, Michigan is one of the top public schools. And it's a huge school, but it gives you all the resources of a big school. But I feel like I'm still in that small classroom type setting. So that was like a perfect fit. On top of that, I also am interested in some like global health work as well. And Michigan, the program that I'm in the GHMP subsec, just like Sienna. So it just gave me the perfect fit for what I wanted to do post grad school.
I think all of my panelists kind of hit on everything on the nail, but something else I wanted to mention was also like the sense of community that you have. I know when I was applying and when I was accepted, I started reaching out to students in the program, faculty, and everyone was so responsive. And I mean, like they were being their true authentic selves. They were so welcoming, so friendly. And that's the kind of community that I thrive in. And that was something I was really looking for. And I feel like that really stood out about Michigan compared to the other schools I wanted to apply to. And just coming here and knowing that no matter what I needed, there were people to help me. I mean, literally any professor I hit up, I was like, I need this and I want to do this. They sent me in the right direction. I'm like, that's dope. So even though that they can't help you, that they'll definitely give you a resource that will help you. And I mean, you really can't get that anywhere else. Okay. Michigan got that for you. So that was one reason why I chose here. My next question is, how do you guys stay like involved? I know once you come into grad school, we have a very tough curriculum. We stay really busy in classes, but what do you guys do to kind of stay like keep yourself busy professionally, and how do you guys get involved? Or also, what are you guys also involved apart from academia?
I guess I can go start this one off. So, first off, there are more student organizations in the School of Public Health than I can count. I think we're all involved in several different ones. Personally, I'm most actively involved in the Health Policy Student Association, which has been wonderful. And just how to stay involved professionally outside of the School of Public Health, I think really leveraging career services, LinkedIn, taking advantage of coffee chats like we touched on before. The alumni network is awesome. And just sending out an email and saying, hey, like, do you have an hour, 30 minutes maybe to sit down on Zoom and just talk has been super, super helpful. And then just joining different professional organizations or signing up for newsletters and actually reading the newsletters, because we get way more emails in a day than we probably want, but making it a priority to just stay involved in what's going on in those organizations.
So just being at Michigan as well doesn't mean that you're only looking at organizations in the School of Public Health. Like Robert is getting his MBA and Jessica is taking classes at Ross. There are other schools that actually have clubs or organizations in healthcare, life sciences, or something along those lines. So that's also some resources you can tap into. I myself wanted to just have some time to be part of clubs or organizations that had nothing to do with healthcare, just so I could take my mind off of something. So I like playing tennis. So I joined the club tennis team here in Michigan. And, there's so many different clubs and things that you can do you can find ways to get yourself involved in the field of public health and healthcare, or just out of it as well.
I think one thing I'll add is if you're interested in doing research, there are a lot of research opportunities, and you'll naturally form relationships with professors and get introduced to these opportunities. But I had a lot of fun this past year doing some like food policy related research with professors, like both in our own department and then outside of our department. So it was a great way to meet faculty across the school. And obviously I'm not going to be an expert like any of them, but I think it's nice to leave school having gotten a more formal taste of how the research process works, and then just having a couple topics that you actually know quite a bit about because you worked on the research that went into that paper.
Yeah, I think I'll add that aside from also like Michigan having a huge resource for research, Michigan Medicine also has a lot of different partnerships and opportunities for students. So I actually this past year was working as an intern at the Center for Research and Health Transformation, which is part of Michigan Medicine, but more on the policy and research side. So there are other opportunities to stay involved. And one thing that my peers didn't mention was Michigan does do a lot of case competitions. So I've done like 3 or 4 case competitions these past 2 years, and that's another great way to, one, get to meet your peers, but 2, get to work on some sort of innovative strategy that even, health systems might actually implement.
I feel like that was really good that you brought up the point about case competition. I feel like that's a very staple part of our program. Just having the opportunity to get hands-on experience on like actually like contributing or like solving like issues within healthcare systems like is absolutely amazing. I've learned so much from them, and it's just amazing just being able to have that opportunity and also work with your peers. Another question I do have is, being that we've all been in grad school for a while now, what's the difference between grad school and your undergrad?
I'm enjoying what I'm learning. I'll be honest. I'm enjoying what I'm learning. And just that this year that there's so much more. It's more than just like theories or things that you're learning in the classroom. It's more of, building those connections out with your peer, with your faculty member, with your professors, because ultimately they're going to be your peers when you go into the field. So there's like the added component of where you may not be interested in the lecture or the theory, or you may not understand it, but the value comes from, building those connections and struggling with your classmates. And it always helps to actually enjoy what you're learning. So.
Yeah, kind of building off of what Mohit said, I think the biggest difference is how much more independent grad school is than undergrad. There's a lot of flexibility, and we've touched on it a lot, to kind of build this program to fit your interests by choosing your electives and attending lectures at different schools and within different departments. And I think you really you get out of this program what you put into it. And so really being able to leverage that like self-motivation and that independence that's afforded to you has been really, really fun.
Yeah, I always say that this is a professional degree and not an academic degree for graduate school. So just because you're taking classes doesn't mean that, like you should be more professionally involved, as in like building your network. And really, you do a lot of like case information within your classes. So it is like you're learning about real world problems and how you can apply and learn those skills to address that. So yeah.
I feel like I did undergrad maybe like a little bit wrong or something, or reversed it with grad school. But I feel like when I think about undergrad, which has been a few years now, from what I can remember, I feel like there's always this invisible pressure of, oh, you need to become, president of some club, or you need to be in a club for 4 years because you're trying to show, graduate schools or employers that you can stick with something and that you can work hard for an extended period of time. But I feel like school, at least for me, I've just felt less of a pressure with that. I've joined clubs for a year and then left them, both in the public health school and now at the business school. And I realized it's like totally fine, because there's just not that same pressure, I think, to have to stick with something just because you need to show people that you can be professional or something, right? Like, I've just felt more freedom to explore and be like, okay, yeah, I learned a lot, in that year. Let's just try something different, this year, right? And then next year, I'm going to try a whole different set of clubs. And it's like totally fine. But at least for me, I feel like it's been great to not feel that sort of invisible pressure in grad school. And I guess the other thing I'd mentioned too is that it's kind of nice in some ways to have this pause, if you will, for the couple of years that we're in school. Like, I feel like, at least in grad school, I've taken a lot more care of myself, or just thought a lot more about my holistic well-being, versus I feel like in undergrad, because there was just so much pressure, right, for all of us to graduate and make it to the next step and whatever, right? I don't think I took as much time to think about, oh, like what really matters to me and like what is balance within life and all these sort of fluffy things that actually are important. I feel like coming back to grad school, I've just been able to think about that a lot more. And I feel like I'm just honestly happier just because I'm balancing things better and I know where my priorities are. And it's not just about like studying, pedal to the metal every day.
Thank you guys. Those are absolutely amazing points that you guys made. One thing I would add is that that's the difference between undergrad and grad school, that when you're in grad school, especially within our program, these are going to be your colleagues and these are people you're literally going to be in the workforce with as moving forward. So just being able to like form those relationships with your cohort and seeing you guys like moving together and actually working in the same field, I feel like it's something that I've really enjoyed about being here at Michigan. But yeah, another question I have for you guys, what course have you guys found most helpful, like through the courses you've taken?
So one class that I really love is healthcare systems organization. It's sort of like a requirement, but you can take a different class to fulfill that requirement, but it's taught by Christine Steed. And she is, oh gosh, she's like amazing, but she has another job outside of teaching. She's like a consultant. She has her own consulting. She's like the CEO of this ELSO foundation and organization. And you go through a lot of casework with her and sort of have to, like, she throws these like memos at you where on Thursday she releases a memo and you have to turn it in by Friday. And it's like real world, like what is going on right now. And you kind of have to like act as sort of like a CEO or like some sort of person to give a press release. But I think that class was so helpful for me for my internship because I ended up doing things that we did in that class for my internship. And you just really get to learn more about her and sort of her perspective on healthcare and like sort of the skills that you will bring to your internship and after graduation too.
So I'm going to cheat here. I'm going to say 2 classes instead of 1, but they go together. And I see Professor Jarman on here, which makes me so happy because she's a great professor. The classes that I mentioned are related to her line of work. So one of them is 615, which you will all take, is the, Intro to Public Health Policy. And then I'd say one of the companion courses is 685, Politics of the Public Health Policy Process. I hope I got that right, Professor Jarman. But I took both of these courses last year. And I think regardless, if you go into policy or not, I think these were just great courses just to become a better independent citizen, if you will, of this country. I feel like coming into both of those courses, the way I formed my opinions of things was through listening to podcasts or reading to what this person said in the New York Times or the Washington Post. And these people are all making great points, right? But I didn't have an independent sort of foundational knowledge to kind of sift through things and form my own thoughts on policy matters or policies, moving through the whole process. And I think through both of those courses, I learned so much. And, now when I listen to podcasts, I'm not at the level of Professor Jarman, who is really great at analyzing things, but I'm at least able to take that step back and think about, okay, like this is what they're saying, like this is like what I think, or even like, when this new administration came in, I was able to at least think to myself, like, okay, like what might some of their priorities be and who are going to be like the lobbying groups that might stop those efforts, right? And all those like nitty gritty things that come together to influence the world that we live in. So I think this can even be applied beyond health, which is why I feel like it was just such a great foundational set of courses, just becoming a better, citizen, if you will. So I know Professor Jarman has taught both those courses, so huge fan of her and those courses.
I echo what Robert said. Professor Jarman is wonderful. But speaking as a student who's part of the global health track, I think one of the most helpful courses we are required to take for that track is the Healthcare Organizations and International Perspective course. because it really breaks down not only the basis of healthcare organizations just in general, but it really offers a comparative lens in order to look at healthcare systems around the world. And so not only can we look back at the United States and kind of see some areas of improvement or what we're doing well, but it gives you a more globally focused understanding of healthcare.
So Jessica said the class that I like the most so far, and I'm actually in it right now as we speak, and just submitted a mem. Actually, I have to work on the case later tonight that we need to submit. So still working on that, but honestly, I think that class, I spent a lot of time this semester doing a lot of theory work. So this is like a good way for us to kind of apply all the stuff that we've been learning in all our different classes. And so I'm interested in consulting and administration. And so that course does a really good job of getting, or at least opening my eyes and showing me what like a day-to-day would look like, or even an hour would look like at work. So that would definitely be one that one of my favorites.
Thank you. I would agree too. My favorite class is the 603 class. You guys will enjoy it, and it's going to push you. Okay. It's very challenging. It's going to push you, but it's great. I do guarantee that. So we're almost at time. I do want to ask one more question to our panelists, more specific to our second years. An internship requirement is an requirement of our program that tends to happen between your first and second year. And I feel like it's just a great learning experience for all of us. Just wanted you guys to kind of touch on your internship experience, kind of what it was like, what you learned on it. And with that being said, once you touch on that, we will open it up to questions. So if you guys can start putting your questions in the chat box, that would be great. But go ahead.
I can go first. So I did my internship at Cleveland Clinic this past summer in their community health institute. So that's a combination of their general medicine and population health institute. And I got to play the project manager role for 8 months, which was really fun, really exciting. And I would say that, so I worked on a lot of like strategy projects. I also worked on specifically community health projects and quality improvement projects. But I would say that our program really sets you up for success for your internship. Tyra, who's not on here, is the program internship coordinator. So you have this whole plan that you do before you even start your internship. And you can use all of like the School of Public Health resources to really set yourself up for success. And so I would say that I loved my internship experience. And I would say that Cleveland Clinic has a lot of alumni from Michigan. So you have that alumni network, and the program director is actually a Michigan alumni, which is why they probably take interns from Michigan. So yeah, I would say that, I mean, this program, I've seen my peers excel so much throughout their internship, and I'm ready to give back as an alumni too, wherever I end up.
So given what I was looking for last summer, honestly, it was really hard to find something. So I was really lucky to end up, as I mentioned before, my interests, are in like the food realm. So I ended up working at this urban agriculture consulting firm, which is probably like super different from what anyone would do in HMP, and probably like not the typical path. But I will say though, earlier in the process, sort of pre-COVID, when I was like reaching out to alumni, there were a lot of people doing really interesting things. Talked with one person who was previously part of Michelle Obama's like Let's Move initiative and worked on a lot of public health initiatives there. And then I remember also talking to someone who was like the director of like strategic initiatives or something at like the Detroit Public Health Department. So definitely a lot of different people doing interesting things across like the spectrum of public health. So I feel like you shouldn't have a problem finding people who are doing things that you're interested in.
Fantastic. Thank you guys so much. So now we'll open the floor up to questions. Feel free to unmute, ask anything your heart really desires to ask. We're here to answer. And yeah.
You can ask us hard questions too. I recommend that you ask hard questions.
Ask all the questions you want to ask so you can have an informed decision. It's really important, you guys.
I have a question, if that's okay.
Yes, it is.
So I know, Jessica, you mentioned earlier, you asked people hard questions about like just the program in general. And I think something that's important is like, what are the difficulties you feel like, as cool as University of Michigan is, what are some of the difficulties you guys had, and like, how did you overcome them? Was it location? Was it getting into certain classes? Like, just any of that information would be great.
Yeah, so I can answer that. So coming from a second year perspective, so as part of our requirements, because we do MPH and MHSA together, there are certain competencies and core requirements that the school has to follow so that our degree is like recognized. So from a second year perspective, we actually had to take a lot of public health classes, which I personally enjoy because I'm coming from a public health perspective, but I know that that would fill a lot of time for students. So sometimes you would have to like course overload to take other classes at other schools. And actually us second years gave that feedback to our program. And so I know that for the first years, they actually cut some of those requirements. So now first years have more flexibility. So I would say that that was something that was hard for my cohort specifically, because a lot of us wanted to take additional classes, but that would mean that we would have to add it on top of work and other courses that we had to take. And so just having like our program actually take into consideration our feedback, I think was really helpful for the first years, but obviously the first years can talk about that too.
All right, I'm going to ask some of the questions for the chat. Thank you so much for that response, Jess. I have a question saying, how different is the MHSA program versus the MPH program?
I can speak as an MPH student. I personally chose the MPH track just because of my background being in administration and business. I really wanted to kind of open up my perspective and gain some new ideas, new courses. Credit wise, they're pretty much exactly the same. There aren't any more requirements for the MPH students than the MHSA students. Most of the core classes you do take together, especially your first year. However, like Jess was talking about earlier, some of the MPH like core public health classes are a little bit different. We take nutrition, I believe, and like an environmental health class that the other students or the MHSA students aren't required to take, where they take more economics, accounting, finance-based courses.
Yeah, I would think that really answers the question, like really answers the difference between them. Just a couple courses really what sets us apart. And I'm also MPH, and I chose that route more so because where I see myself going in the future, more so in population health. So I kind of wanted to really stick with that MPH degree that will really give me that focus. So yes.
So Michelle, I wanted to jump in and just say, we have a lot of questions and we want to keep to the time because our alumni panel is ready to go. So what we will do, the one question I do want the students to answer is that there was a question about how have you developed, so how's it been forming relationships with faculty and other students now that's predominantly online? If you could speak to that. And then also for the admitted students, we are as of today, this is as of today, planning for in-person fall. So that's from the president of the university. So this may be different for you, but the skills the students have gained while they have worked in this unique environment are important for you to hear. So if you could answer that, and then we'll wrap it up and have our students answer these other questions and send out an email to everyone with those answers, okay?
Fantastic, sounds good. Take it away, panelists.
So coming from a second year perspective, so we got to spend our first semester fully together. So I can talk about the transition to remote learning, but I would say that my peers have tried really hard to still stay engaged, whether that's turning on their cameras during class, and also you have H&P class reps that try to do social activities. So I know the first year cohort is a lot more social virtually than my cohort is right now. And I think that's because we spent a lot of our time together in person. Like we would do bar crawls and have a lot of just like we'd pass each other in the hallways and just talk to each other. But I think, you know, like trying to mimic what we did, you know, when we were in person together and trying to make remote learning as easy as possible for our faculty and still trying to engage with them as in like going to their office hours or staying after class just to talk to them to really build those relationships.
Yeah, I would add really quickly from the second year perspective, echo what Jess said. I think what I'm just grateful for as well is, you know, I've met some really great friends in this program that even during COVID, you know, when we kind of returned to our Southeast Michigan homes, like we still found ways to come together during the summer and keep in touch and everything. And I am just really grateful, honestly, that I found those friends and stayed in such close touch with them throughout, you know, the past 12 months and everything. So very grateful the program gave that to me.
I think Jess may have been putting it lightly when she said that the first year cohort's a little bit more social online. I think we are borderline codependent on one another at this point. We
Literally.
we do way too many like social gatherings. We did like a painting and ice cream night the other night. We do game nights. We've got a book club that we've started. We did like a cookie exchange where we mailed cookies to each other around the country. So again, I am hoping that it stays in person for you guys so you don't have to get as creative as we did. But I don't think any of us have ever had a problem trying to make those connections either with each other or with faculty.
All right, thank you so much to our student panelists. And again, we are going to get started with our alumni panel. We have our moderator here, our alum, Bo Snyder. So we're going to turn it over to him to introduce our alumni panel.
Hey, Charlita, this is Bo. How's the audio doing?
Good, I can hear you.
Cool, cool. I'm going to pause for a second until I can see Alex, Tiana, Jonathan, and Jay.
All right, I'm spotlighting them as we speak.
And while we wait, can I say, I wish the student panel could have gone on for a little longer. You guys were great.
They were.
I'm taking notes, and you're bringing back memories. It's so cool. There's Jay. All right. Jay's got some serious books going on. Tiana, hey, how you doing? And let's see, I know there's Alex Donnelly, if that is indeed her last name. We were debating that. And
Yeah.
Jonathan's somewhere. We never know about Jonathan.
Jonathan's here.
He's a super good guy, but you know.
Jonathan was waiting for me to admit him. Thank you, Jonathan. We've had Jonathan in the waiting room for probably 25 minutes. I'm very sorry about that.
Gosh. Cool. Jonathan, yes. Hey, so before we dive in, let me just welcome the admitted students. It's so cool to be able to spend a few minutes with you. For some of us, it's been a long time, but for me, it's been a long time. But we have all been in your shoes, so we can empathize and we know what you're going through. And so, I mean, our hope is that we give you some information that can help you make your decision, because you're about to make a really important decision. So, so here goes. All right, we've got to have a game plan, and we've got until 6 o'clock. And the game plan is that the first rule about the game plan is that we can change the game plan. So all of my panelists know that. And if we need to go off script, if we need to do a little Baja action, we can do it. The panelists might start asking questions spontaneously. I will start with a few remarks, and then each panelist knows, then we're going to let each panelist take between 4 and 8 minutes, and I will be timing, so that you can each kind of just tell your story. And tell it in the way you want to tell it. And then my softball question in there is, please reflect on a good memory, or what's a big positive takeaway as you reflect back on your time in the program. And after we get through each panelist's stories, then we will go to some more of a round robin question. I mean, maybe we'll have some lightning rounds, maybe there'll be some questions we'll linger on. We'll do a little bit more of that. And then we will make sure that we wrap up with at least 10 minutes of questions from the audience. And I saw during the student presentation how you just started to fill up the chat. It took a few minutes, but the chat just started to fill up with lots of questions. So we want to leave time for that. So, okay, with that as the game plan, I'm just going to briefly give you my story, but I'm telling you my story to make a point. So back in 1988, back when there were dinosaurs, I graduated on a Saturday, and 2 days later, I started my 18-year run at Bronson Methodist Hospital in Kalamazoo, Michigan. And I had a great run there. And I started on my first day, I was the strategic and market analyst. It was a new position. And I basically punched a lot of data into what was then called Lotus. And it's called Excel now. And then I had a great 18-year run there. I worked for the CEO, got to do kind of everything. And at age 42, I had a midlife crisis, and I decided I needed to do something different. And so of all the stupid things you could choose to do, I chose to leave that safe environment and start my own one-person healthcare management consulting organization. And so I have spent the last 15 years in Suite 201 of Snyder World Headquarters, which you can see right here. And the last 2 or 3 years, I've retired. So I'm kind of living a different life now, and I'm loving it. I might get back in, but I like my wife, and we hang together, and life is good. And being retired during a pandemic is where you want to be. So I tell you that to make this point. When I did that silly thing at age 42 and jumped, I had to find clients. And so I started to do what I really had not done well before, which is I started to use my alumni network, and I contacted that network hard. And what I discovered was, if you are a student in this program or an alumni of this program, and you reach out to virtually any other alumni and ask for 30 minutes of their time, you got it, no questions asked. And I talked to dozens of alumni, and they were incredibly helpful to me. So I just wanted to make that point. As you're making your decisions, think about kind of that alumni network and how that might benefit you for the next 40 or 50 years of your lives. Okay, that's my quick story. Now, I want to open it up for kind of to my panelists, and I'm not going to call on anybody specific. I'm just going to wait to see who volunteers. Who's going first? And you all are muted right now.
I can't see the rest of the panel, but I can jump it.
Okay, Jay beat Tiana by a microsecond. Jay, it's yours. Go ahead.
Okay. Hey everyone. Jay Backer. Great to meet you all. The quick story on me is I am an HMP MPH grad from 2014. Came into the program thinking I wanted to be a policy wonk, thinking I wanted to have a little basement office, probably full of books like this. This is my parents' house right now. But thinking I wanted to go work on the Hill, and I came to HMP, met a lot of really interesting folks. There's an adjunct faculty member named Joe Horton, who I talked to during my probably second week, and he convinced me that being in operations was where I wanted to spend my career. So went on to spend a handful of years at Cleveland Clinic after graduation. Was an administrative fellow there, did a lot of work on the international side of the practice, in just under 5 years there, did work in about 15 different countries. It was, you know, a really, really wonderful experience. And then decided just this last August to join an organization called Oak Street Health. So we're a primary care group growing very rapidly across the Midwest, but into the South and Atlantic regions now. We are we're on a mission to we say rebuild healthcare as it should be. So we think healthcare should be personable, equitable, and accountable. And so we take full risk on our patients. We're totally accountable for their outcomes. And I think it's an organization that I decided to join because of what I learned on day one of the curriculum at HMP in a class called HMP 600, which is that social determinants of health are these big intractable issues that are incredibly difficult to solve and to address for our society. And so I saw an organization running really hard at trying to solve the hardest problems in healthcare and thought, you know, what a cool place to be. So I work as director of population health, work on essentially projects that are going to expand services to our membership, keep them out of the hospital, keep them happy, keep them healthy, and save us money in the long run. So that's things like taking better care of our patients with chronic kidney disease, taking better care of our polychronic patients or patients without transportation, patients who need access to mental health care, and a whole variety of other issues. And HMP plays a big role in my life. To start out with, my boss is an HMP grad. We just added a couple of HMP grads to our team. There's several of us in the organization. When I was at Cleveland Clinic, it seemed like half of the people who came through the fellowship program were graduates of the program, as well as like nearly everyone who we tried to recruit onto our team. So I think one of the big reasons that I came to this program and something that remains true today is that this program is one of the best sources of talent, I think, in the world when it comes to people who are just excellent leaders in healthcare, but also have the right ethos in healthcare and can balance both their managerial acumen and their broader public health acumen. And to round this out with my favorite HMP memory, Bo, you sent that softball question to us ahead of time. I spent a lot of time thinking about it. I couldn't put my finger on one thing, but I think as is emblematic of our pandemic times, there's just so many times when I was, you know, sitting in the SPH cafe with classmates, or, you know, we'd go out for a drink somewhere on State Street, and just those small moments in retrospect, getting to know people who are now such a big part of my life. I mean, people who were groomsmen in my wedding, and people whose kids I know and love like my own, and are also in my industry, and people who I can have an incredible personal connection and conversation with, but who are also people who I respect so much as healthcare leaders. Like, that is just one of the best things that's happened to me in my life.
Jay, very cool. Thanks for getting us kicked off right. Who's next?
I'm happy to take it now. Thanks,
Thank
Bo.
you.
Thanks, Jay. And Jay, I think that you really get to the point that you underscored the point that Bo made. And I think we will probably bring it up many times over the course of this next, 45 minutes, but the Michigan Mafia is alive and well, and it is something to be leveraged, and something that is such a phenomenal, wonderful, powerful tool that you get handed to you as part of your toolbox in your career, just by being a Michigan alum. It's a really incredible thing that I didn't really quite understand the impact to until I joined Michigan. So I really do think that point cannot be underscored. but just by way of background for me, so I'm Tiana, graduated in 2019, so a newer grad of the MPH track within HMP. And, you know, my arrival to HMP was, I guess, somewhat different. I had, prior to joining the program, I had worked for California's Medicaid agency for about 10 years, doing different areas of health policy, the most recent of which was a huge federal waiver program for hospital quality improvement. And, you know, it's funny, my job with the Department of Healthcare Services in California was taken on because I was just tired of working in the restaurant industry and wanted something a little bit more professional to get my, you know, get my toes wet with just working in an office environment and what have you. And what I found over the course of 10 years, because admittedly I was on a law track, I thought that that's what I wanted to do. Law school, you know, it was kind of, I had the blinders on, that's where I was going. And it wasn't until one of my colleagues who turned mentor, who actually also at one point in time was my boss, the medical director for California, challenged me and essentially said, Tiana, you don't need to be a lawyer. Think about public health, and like gave me all these, you know, things to read and just discover that space a little bit more. And I realized after reflection, it was kind of, I mean, really, I felt like I was slapped upside the head. And I'm like, well, why do I keep returning back to this place? And how come I've invested so many years of my life for this organization if I don't really have a passion or feel a calling to it? And it was one of those realizations where I thought, oh yes, this is the place and space for me. And I, you know, really found that serving vulnerable populations is something that I felt called to do. And I felt that pursuing a master's degree in public health helped me further see that through. And so that's how I arrived at HMP. And so now I work at Henry Ford Health System right in Detroit as their health policy advisor. And that is a very kind of broad sweeping title for a very broad sweeping job. My job is really interesting because no 2 days are the same. I like to classify the work that I do kind of into two bucket areas. We have the reactive policy work that we have on our plate, and then the proactive policy. So some of the reactive work is answering, we oversee all of the legislative and regulatory efforts for the system. So that's at the state and federal level. So any changes that come out through federal regulation, it is our job to read through those massive federal register documents, understand the components of them and how they'll be impacting our hospital from an operational and cost standpoint. And then we provide written comments on, how those things will be impacting us and whether they're positive or negative, providing suggestions on how we think that they could be improved. And like I said, we do that with state legislation as well. So like, for example, one of the things I had a call today all about surprise billing and what those new implications are going to mean for our hospital and health system rather, once, all of those, the implementation period takes effect. And, it means a lot of, framework and kind of tape that we have to create and then step through. But, it also, what we would argue is that it is not necessarily, the price transparency component of it. I know I'm getting really weedsy, but I'm just wanting to give like an example of my work, is not always great for the consumer, even though that was the best of intentions. So what we have done is work both with state legislators and the federal government to try and advocate to improve that language so it actually can be useful to consumers rather than it just being this, oh, this is a good idea, we're going to throw it up on the wall and make all these hospitals comply with it. So that's some of the work that we do, is that, the regulatory and legislative stuff. The stuff that gets me out of bed is the proactive policy work. So right now, an example of a project that we're doing is around community health workers. And so our health system utilizes community health workers in big ways, but one huge problem is that they are primarily funded by grants and there's no sustainable funding options for community health workers now. And so that is a problem because when grant funding runs out, community health workers either have to find another form of funding, or they, the job sunsets. And that's not good for them. That's not good for our patients. It's not good for the community programs that we are running that employs them. So we have been working with state legislators to get some boilerplate language drafted and kind of in the works to provide sustainable funding solutions for community health workers so they can be reimbursed appropriately, just like any other provider in the industry. So that's something that's really exciting that we're doing now too. And then of course, over the past year, COVID has been everything. So all of the new stimulus, all of the bills that have passed, the CARES Act, the omnibus that passed in December, again, we have to understand all of the components that go into that bill language, what kind of funding is going to be flowing to our system, what funding availability, what funding is available to us and not, based on definitions of what a rural hospital is and things like that. So it's been our job to we have to analyze that language, and then we work with our senior leadership and our finance folks to make sure that we are tapping appropriate levers for funding and complying with new rules around telehealth and virtual care and things like that. So kind of all over the place, but that's what I love about my job, because it's so interesting, and I'm constantly having to learn new areas of what healthcare delivery and public health mean. And somebody who swore up and down I would never work in a hospital, here I am, and I'm absolutely loving it. I thought I was going to be the boots on the ground gal, working out in the communities. And what I've realized, and quite humbled by through my education at Michigan and within HMP, is that you can still have really meaningful impacts at the community level, even working in a hospital. And so I feel so grateful to be at Henry Ford and to have the opportunity to kind of live in both lanes. So I will stop there and let whoever wants to take it next, Alex or Jonathan.
I can go next. So I was laughing there because I graduated the same year as Tiana, and we were both the queens respectively of the I will never work in a hospital crew. So that was just funny for us. So my name is Alex Donnelly. I graduated in 2019. How I got interested in healthcare was actually, I had a lot of research experience when I was in undergrad, and my research experience was in sexual assault prevention and response on college campuses. And I was a person where I was like, oh, I really, I considered going into nursing or being a doctor and saying I want to be in the field responding to these things. But over the course of my research, I kind of discovered, there are so many ways that this issue is messed up. And it's not always dependent on, a one-on-one provider interaction, or it is oftentimes dependent on training within a hospital system. So from an operations perspective, how are you making sure that your staff is trained to respond to this issue appropriately? It's a funding issue and a policy issue at the state level. How do Michigan's gun and knife laws play into this issue? How does the Violence Against Women Act play into this issue? I was working on college campuses, so how does Title IX play into this issue? And basically, throughout that work, I got really interested in policy and how we can use policy to help the specific populations, which are survivors of intimate partner violence. And so I graduated from U of M for undergrad. So if anyone has any questions about the difference between undergrad and grad school at U of M, I'm happy to tell you. It's mostly that you have to show your classmates where the chem building is, and you don't have to do that in undergrad as much. So I actually took a year off in between grad school and undergrad because I kind of had two tracks where I was like, I can do this research and reproductive health stuff, or I can work in higher ed, which was the other thing that I did. The story of my career is that Alex does too many things. So I actually deferred my admission to U of M for 1 year, and I went and worked in higher ed at the university for a year in graduate student development, which was actually really useful when I was a graduate student, because I was really good at advocating for myself, because I was like, this is all the things you should be doing. So I deferred for a year, and then I actually had been admitted to HBHE, which is Health Behavior and Health Education and Social Work. And I think in June before the year we started classes, I was like, no, wait, I want to do HMP. And I'm very lucky because someone dropped out. Thank you. And I got to take his spot. So I ended up, yeah, he was on all of our class emails, and I thought about like emailing, be like, hey, thanks for dropping out. I got to go to HMP. So I ended up in HMP because I was really interested in that kind of like larger policy perspective. I think so like I said, I didn't have a ton of like healthcare experience. So I did a lot of working while I was in grad school. I interned at a lobbying group where we called it balance billing back then, where we talked about surprise billing. And then I also was a research assistant on a project about like federally qualified health centers and human trafficking. And I was also a graduate student instructor in a research methods class. And then after graduating, I ended up I also contracted at CHART for 2 months, and then I went to Mathematica. So I work at Mathematica. Until 2 weeks ago, I was a health policy analyst, and then we had a corporate restructure, and now I'm an advisory services analyst, which means I do the same thing, but I have a different name. So in my job, I do a lot of different things because this is the theme of my career. One of the things that I do is I facilitate payments for physicians and for hospitals for alternative payment models in Medicare. So I'm like reviewing SAS programming and making sure that whatever our programmers are doing is meeting the actual policy of those programs. I also review some payment models that come through. So if any physician groups or hospitals, like if Henry Ford, where Tiana works, wants to submit a payment model to Medicare, we review those proposals. It's like a fun grad school assignment. You get to like take apart this healthcare proposal. And then most of my work is on Medicaid right now. So I work on serious mental illness and substance use disorder demonstrations and Medicaid, and making sure that states' demonstrations are meeting the monitoring and evaluation rules that are set down by CMS. So again, I get to read federal regulations and state documents and stuff, which is fun. I also do some data analysis for Medicaid, and I just got on to come full circle from my initial interest in healthcare. We are just starting a project right now where we're contracting with a state foundation, and we are looking at ways to use Medicaid to improve like care for survivors of intimate partner violence, and also how we can use Medicaid for prevention of that. So I'm super excited, like jumping up and down when I found out on Friday that we got the bid. But that's kind of how I ended up here and what I do at my work.
Hey, Tiana, thank you. Hey, before we go to Jonathan, do you have a favorite memory?
I completely forgot about that. Yes. And I actually took notes down because I had a hard time, like Jay, like paring it down to any single thing. So I'm going to do academic and otherwise. The outside of school, my favorite memories were game days for sure. I know COVID is kind of different, you know, everything's virtual now, but hopeful for you guys that if you choose HMP that you will get to experience game day. It's amazing. I came from an undergrad that didn't even have a football team. So like this was just the best ever. It's, you know, we had HMP tailgates, and it was just such a great way to kind of like cultivate really good, authentic relationships with your peers. We had so much fun together. And then academic wise, I would say best memories Lansing Day, which we can talk about a little bit later. Alex did that as well. And essentially what that was a day that we went and advocated up in Lansing on a couple pieces of legislation pertaining to gun violence and gun policy. And so we sat down, we created one-pagers and sat down with legislators advocating on behalf of these two pieces of legislation. It was so fantastic being able to really dig in deep on issue area and then like put it to work through strong advocacy and policy making. So that for sure was a great memory of mine. Alex, go ahead with yours.
Yeah, Alex, yeah.
Yeah, I also had two. One, I took a qualitative methods class with Holly Jarman, who I think is on this call. And it was this really small qualitative methods class. And we all got to know each other really well. And on the last day of class, we like all brought in baked goods and just like ate a bunch of cake. And it was a very good day. It was just like really nice to spend time like that. The other and this was just kind of in general, and something I really want to emphasize, my cohort, like we loved each other and it was really, really nice. I think a lot of graduate programs are super competitive within, and like we were kind like, you know, we wanted to do our best, but like we ultimately were just like there for each other. So I think just some of the like best memories are just like random people coming back from like case competitions, or like anytime anyone would get an internship or a job or anything cool, and all of us would be in the group chat or in person just like, yes, incredible, amazing. Like we were just all really excited and supportive of each other, and it was just like really good vibes. Like you could go out for the same job or the same internship or the same thing and not get it, but it didn't, like it was still like, oh, you're incredible, I'm so happy for you. So that was just like a really nice thing about that. I never ever felt like anyone in the program was like out to get anyone else. We were all just there to like support each other, which is why every time Tiana says anything, I'm like, yes, correct, because she's in my cohort.
Very cool. Jonathan, you are up.
All right. Hey, everybody. My name is Jonathan Waller. I'm a consultant with a management consulting firm called the Chartist Group. We are specifically focused on healthcare strategy and operations. So I'll be quick because I'm going to give you guys some time to, get through your questions. So for me, I was a non-traditional background. I actually went to the University of Tennessee. I was a sport management with business administration major. I had no plans to ever work in healthcare. I actually got into U of M as a dual urban planning and health management and policy student. And I really came more so for the urban planning piece. But, my ultimate goal was to do something where I can use, business acumen to impact large communities, mainly for people who look like me, to be frank. And so healthcare is just how it shook out. I don't have any family. I have a sister who's an ED nurse, but I don't really care what she did. So, that's just how it shook out. So I took a leap of faith coming into HMP. And for me, coming in, I was doing homework for the homework, quite frankly. My first year, I didn't know very much at all. And I felt like I had to work harder than most to understand anything. But, it came around. And, for me, I really enjoyed a few things coming into it. It was just obviously the distinction of the program. It was highly ranked. That showed me that, I could, make good money, have a good career, and impact a lot of people. The ROI of the program was there. And that's why I took the leap of faith. And also the network. I actually got referred into the program by a guy who I went to high school with, and he kind of gave me some insight around how the program worked. He connected me with other people in the program. Honestly, he was a white guy. He connected me with Black people in the program. I was able to see that lens and make sure that it was a good environment that mattered to me, and that's why I took the leap of faith. But it was great. And my first year I worked, I actually leveraged my sport management degree to be an academic mentor for the football team at Michigan. So that's what I did for my first year. And, oddly enough, I got paired with a couple guys who were still NFL starters. So that's cool to see them blossom into their careers. But oddly enough, when I was in Michigan, I graduated in 2016, but I was there Brady Hoke's last year and Jim Harbaugh's first year. So between the time Coach Hoke got fired and Harbaugh got hired, it was a lot of rigmarole with the academic calendar and the students and all of that. And you're really at the whim of the athletic department. It was killing me in school. So after my first year, I stopped working with them. And quite frankly, my second year, I decided that I think if I work really hard on the case comp circuit, I can make the same money I would have made working for the athletic department. And it happened. We were able to win 2 national case competitions and make a few $1,000s. And, that's really what floated me my second year. But the skill set I gained at U of M was really, number one, understanding that iron sharpens iron. My classmates were extremely smart, and they taught me so much. They taught me how to interact with people who are really developing expertise very early in the game and in industry, but also how to learn from them. And the classwork taught me business acumen, but also just the overarching outlook on the healthcare industry. What's the current, what happened before, and where the industry's going. And it gave me enough of a skill set to be able to land an administrative fellowship. And at my fellowship, I specifically chose the system that promised me to see things from the CEO's eyes for a year. And so that's what I did. I went down to Columbia, South Carolina. I learned how a hospital system works, and then I decided that I wanted to see other hospital systems. So I broke into consulting. And I'll say this: I've had 3 jobs now since graduation. All of them have been through a Michigan alum. For jobs that I've turned down, 90% have been through a Michigan alum. the professional network that I've built beyond Michigan alums. The bridge has been Michigan alums. And that's why I'm here today, is to talk to you guys and say that, you know, I've been blessed for my career to be as fruitful as it has been thus far, and it'd be nothing without Michigan. And I can't imagine going anywhere else but this program. I'll caveat and say that, you know, you get out of the program what you put into it. I put countless hours into networking, into developing relationships with my classmates, both in and out of the classroom, and it pays off huge dividends daily. Honestly, I still talk to a lot of people every day from U of M, but I had to put that work in. You know, you're not going to come into this program and it's just going to create a wonderful kingdom for you. You have to make sure that you realize the resources that are here and position yourself to develop and grow. You're really the controller of your fate. But this, to me, is the best program in the country to come in and have those tools and resources at your hands, and an alumni network across the country. You could decide what state you want to live in now, and you probably could land a job there if you tried hard enough with this program. So that's my spiel. And, you know, at Chartist, I guess, you know, I do a lot of work in M&A, pre and post merger. As you guys know, the healthcare industry is seeing massive consolidation, massive partnerships to stay alive, but then also financial performance improvement at the hospital health system level, you know, getting into the service line level, clinical ancillary services. How do we save money? How do we make money? How do we prepare ourselves to be positioned to grow in the future and be a flourishing health system in our market, whether that's local, regional, national, things like that. A lot of really cool work we do at Chartist. So feel free to look us up and reach out if you're interested at all. But yeah, so that's my spiel. I'll let us get to the questions. And my favorite memory, to me, I encourage anyone who's going to graduate school to do a residential program, because there's nothing like immersing in the university setting. For me, I'm a sports guy, obviously. You know, I love going to, you know, the football games and the tailgate scene, but just being on campus and being connected to university, being connected to the Michigan brand. You know, I travel a lot for work. You wouldn't believe how many Go Blues you get anywhere you go. And being connected to this network is one of the best things that could ever happen to you, even outside of the healthcare industry. There's a huge Michigan bias globally. I've been all over the place. I've worked in the US and Canada. I travel for fun. I swear to goodness, I've never been in an airport and not seen a Michigan hat since I've graduated from Michigan. It always happens. And, you know, one of the things they'll teach you at Michigan, not just HMP, is that Michigan people look out for Michigan people. So that's what you're paying for. That's what you're signing up for. And that's what I'd invite you to join, you know, if I'm being honest here. So that's my favorite memory, is the sports and just becoming a Michigan man, I guess.
Jonathan, thank you. So cool. Hey, so here's the bad news. We're only 5 minutes away until the time that we're supposed to take admitted student questions. So I told you this might get messy and we might break the game plan. So let me do this. I want us to jump to the student questions and just give them permission to start pumping some questions into the chat. And while they're doing that, maybe I could say a few things. I had a silly question I was going to ask you guys, and I'm going to ask it, but we don't need to dwell on it. And it's that, did you or anyone else in your class get married to anyone else in the program? And, or was my class like the all-time record for that? But I mean, I heard a number of you talk about how close you were, and it's like our class, we were like really close.
I did not, but I think we had 4 or 5 joint ventures in HMP that are still persisting in my cohort of HMP. And I think 1 or 2 more if you count between years.
I think there was one person in my class that married someone who was, or he's about to this summer. I'm going to the wedding. Someone who was in the School of Information, but doing like a dual health informatics. I don't think there was any inter-HMP relationships.
And we have one couple that has lasted. I don't think that there's necessarily a proposal yet, but they are still together. So there's that.
Yeah, I deleted all my social media, so I'm really bad at keeping track of this. But we have a lot of really great friendships. You can have really great platonic relationships too.
Right. Yes, and that was, you know, my response to my memory. My memory was my classmates, and we were close, and we are still close. And I mean, there's still like among my best friends, and I love seeing these people. And it was, and they were smart and they were supportive. It was a motivated environment. There are ambitious people, but they are not cutthroat ambitious. They are supportive, ambitious. And I heard those themes with you all, and that had existed back in the mid 80s as well. So we're waiting for some student questions to come in, but while we're waiting for that, let me throw a question out to the panel. And this is all about the first job. And I have two questions for you to think about and just offer reaction. So the two questions are, how did the program help you get that first job? And then how did the program help you succeed in that first job? And we'll open it up.
I think this doesn't go against what was said about the camaraderie, but I think my class, at least, it was demonstrated that like, you gotta really be prepared in your work. And like, I think it's very clear when you get to graduates from other programs, once you get into the working world, is that the workload we did at Michigan, the preparation that was expected of us was quite frankly different than what others did at other programs. And, senior executives said that. They said the Michigan people are always prepared. They always have, an answer for the answer. They've done their homework and they ask more thoughtful questions. That's honest feedback from others, not me. So I thought we were ahead of the game, to be honest. So it was hard when we were in school, but it's worth it once you get out.
Yeah, I echo that. And then I would say for me, my job was directly due to HMP and the connections that I made. So over at CHART, Marianne Udall Phillips, who's now retired, but she's an all-star of all-stars. She and I had several informational interviews. I always wanted to pick her brain on all things health policy. And she knew that I was in the hunt in Detroit and made a connection with Diane, who is now my boss. But I mean, I think that goes to speak for itself. So not only, is there a reputation that comes with being a Michigan alum or a Michigan student, but it is that cultivation of relationships that got me firsthand my job. So super grateful for it.
Yeah, I'd agree that the job that I very reluctantly turned down was a hospital CEO who came to Michigan essentially and was an alum, who was just looking for someone that he wanted to be part of his organization and his leadership team. And then the fellowship that I did end up taking was run by a Michigan alum, and a couple of Michigan alums at the organization called me and convinced me that that's the job that I should take. Worked out very well. I think in terms of succeeding in the role, Michigan is a place where you truly have so many opportunities to do interdisciplinary things, whether that's with, classes that I took with medical students and pharmacy students in them, or, exposure to the School of Informatics and the certificate program there. It really helps you build bridges outside of just the traditional hospital management discipline. And that's what you need to do effectively in your first job is build bridges, learn to work with others, learn to be a sponge, and learn how to work effectively kind of at the fringes of your domain. And that more than anything is what the program kind of gave me license to do, I think.
Yeah, I would just echo what everybody said, that like I said, I contracted for 2 months at CHART, which is where Marianne was the executive, and she interviewed me and she was like, "You were in my class, you write good essays." And I was like, "I pulled an all-nighter to write that essay. I'm glad you think it's good." And at my current job, I actually didn't, which I should have leveraged Michigan connections, but my supervisor's from Michigan and someone I work with on my projects is from Michigan. They're all just there. And if I am trying to do better as a person that works at my job now, that I've talked to 6 or 7 in the years I've worked there for 2 years, 6 or 7 graduate students from Michigan, and tried to help connect them to the organization and stuff. So we're just always out here trying to help each other.
Here, and I would add, I mean, I had one of those weird stories where my internship between first and second year, that turned into a job offer that fall, and I went into it the following May and spent 18 years there. And I know several people who did things like that, and they just had great runs. So it happens all different ways. A related question, and something like this came through in the student questions, but this is a little broader. So then in hindsight, what takeaway or experience from the program best prepared you for your career? That's a little broader question. Are there any fresh thoughts on that? Let me know if we've covered it though.
One thing I always like to emphasize is the degree at Michigan is not going to teach you everything you need to know about healthcare. No program can do that. But what it does teach you is where to get that information from and how to understand it when you find it. So I think that has been the thing that's been the most useful for me. Like, even if I come across something in my work and I'm like, oh, I'm not familiar with this specific Medicaid program or this specific part of alternative payment models or whatever, I know enough about Medicare and Medicaid to figure out that information, or to ask, or know who to ask to explain it to me, which I think is really important. Like, having that really good foundational knowledge that HMP gives you that really I mean, we have people in our cohort that like went into pharmaceuticals. We have people that went into like management consulting and hospitals. Like, you really can do and go anywhere with this degree because it gives you such a strong foundation and a broad base of knowledge.
I am going to jump in here because we got a question that it's about consulting. And I want to make sure we address it. It says, what advice do you have for someone admitted to the MHSA program looking to get into consulting after graduation, but does not come from a financial or accounting background? Basically, somebody who will be completely changing careers. Thoughts for this person?
I can take that one. I would say that I think regardless of whoever asked this, to everyone, this is a fresh start, and you can get into whatever it is you're trying to get into. I would say that the main thing is you need to build a foundation that is sturdy in understanding the healthcare system at large, right? But beyond that, use your network. We have a ton of consultants. I'm one of one on this call, but there's a ton. Bo's one as well. There's a ton that will pick up the phone and talk to you for 30 minutes, an hour, whatever you need. But then it just comes down to preparation. I'm going to say this with confidence. I know this sounds crazy. You're gonna get the job you want. You're gonna get the internship you want. And if you don't get it, it's because you were supposed to get something better. Like, everybody freaks out and panics. You're gonna get something good. Trust me. Like, if you prepare, if you are aligned, and if it's what's supposed to happen, you're gonna get it. This is the right program. You're the right person for it. It's gonna happen. Do not get gray hairs like I did trying to force something that's not meant for you. It's gonna happen, y'all. So with that being said, as you get into the program, you talk to the right alums, they'll tell you how to prepare. You'll figure out which firms are best for you. You'll interview and you'll get it. And you might do an internship and decide consulting isn't for you. You don't have to be an accountant. What those consulting firms are looking for is that you have an understanding of the healthcare system, and you know how to think on your feet, and you know how to work well in teams and also get along with clients in business settings. So it's gonna happen.
We've had another question come through. Charlita, can you clarify it? But there's a question about paying for school and supporting yourself, and I'm kind of missing it in the scroll. Is there a nuance there? I want to make sure we have a chance to address that one. And then there's something about getting a job in Minnesota that I want us to go to.
Okay, thanks, Bo. So our last few minutes before the breakout sessions, I get this question a lot, and I know a lot of our admitted students have this question. With your insight, how were you able to support yourselves while you were in graduate school? So for those of you who have left jobs to go back to school, and those of you who continued in undergrad and realized that it was way more expensive and much less opportunity for scholarships and things like that, how did you manage? And what advice would you give to a prospective student today in thinking about taking on the making this a financial investment?
I'd love to take that first. So I left a pretty well-paying job, healthcare benefits, retirement, all of that, 10 years. And I admittedly was like, what the hell am I doing? But no regrets at the end of the day. So I fully embrace this top ramen mentality. No, it really though, I was fortunate enough to be awarded a scholarship while I was there, though the scholarship did not cover all of my costs. So I did also have to assume some student loans to go through the program. And because I had been out of the school game for so many years, I was a little overwhelmed going into the first year, and I wanted to make sure that I was, focused up and being intentional with my time. So I decided not to work the first year, just so I could make sure that I, fully kind of caught my stride. The second year I did work, I found a job with one of the professors in the program, helping do some research and developing infographics and things like that around health insurance and the Affordable Care Act and things like that. So that also helped as well. But, like I said, I think, the investment, yes, it is wildly expensive. Even when you do have scholarship and all of that, but the investment I have found has already paid itself back in the job that I have gotten on the back end of this program, the salary that I came in at, and the trajectory that I'm going. So it is one of those things where you kind of have to look at the long game when you decide to take this on. And for me, I have zero regrets. I'm totally comfortable with where I'm at, and I know that it was absolutely worth the investment.
Yeah, I came in I worked like a year, but I did not have a ton of savings. But I'd also worked in graduate student professional development, so I was like ready to fight. Let's go. Someone pay me to go to grad school. And then that didn't work because I switched departments, and you don't get to keep your scholarship if you switch departments. I was a GSI for one semester, which is the term that U of M made up to make TA sound fancier. So I was a graduate student instructor for a semester. My first semester, in that job, you help TA a class. They have a really good union, so it pays your tuition for that semester. And you got, I think it was like a $2,000 a month stipend. So that was sick. That helped pay my rent, and it paid my tuition. For the next 3 semesters, I ended up taking out loans, but I worked. I had 2 part-time jobs my second semester. And then I also did a research job my 4th semester. My 3rd semester was the only semester I didn't have a job, and that's because I ended up getting a scholarship. It's called the Winston Scholarship, and they cut you a check. And I promptly took that check and used it to pay my rent. So there are scholarship opportunities outside of UM, if you're interested in health policy, the Winston Scholarship. There are campus jobs aplenty. There are jobs with professors if you're interested in part-time work. There are you get emails from Charlita and Tyra that are like, hey, this Michigan alum is looking to hire a part-time person, and you take that job. I'm really passionate about getting people GSI positions. So if anyone wants to talk about that offline or message me, am interested in helping you find one, because I can't let go of graduate student professional development.
Hey, Charlita, it's 6:01, so I know we've got to move to the next thing on the agenda, which just kills me because this is a great conversation. This is so much fun. Yeah.
Yes, so thank you all so much. And what we will do is the questions that we did not get to on Friday, when I send out the message to the admitted students, I will ask these alums to answer those questions, and that will come to you in a Google Doc. And so we'll also have the student panelists do the same. So I want to thank everyone. This was great. Our alumni and our students, if they're still here. And right now, for the attendees, and even if the alumni, if you're interested, we have 4 breakout rooms that we have one with Professor David Hutton on infectious disease policy. We have the governance lab and COVID policy with Professor Holly Jarman. We have managing for health equity with Professor Evan Dotson, and then implementing mental health policy with Professor Shauna Smith. So what you can do now, I'm going to open all the rooms, pick where you want to go, and we won't reconvene in this main area. So at 6:30, you can leave. And like you said, if you have any other questions, please email us, and then look for that email on Friday with this recording and the answers to your questions. So thank you all, and the rooms are now open.